Hey everyone, I'm here with the team and we decided to turn on this to do a live because we're doing a staff training and there's lots of good gold we're going through. We got Brandy over here. Hi Brandy. And then I'll flip this around and everyone's gonna be on Facebook. Hello. We got Bailey, David, Derek, Hunter, April, Jenna. See, I know everyone's name. Good. And everyone wrote out objections in different scenarios in the clinic, and then they talked through the process of how they would handle the objections. And so far, it is very, very good. And now you're going to talk about David's, which is going to be when a patient says, "Can I just do warm-ups at home?"
Yeah.
Or not do warm-ups?
Yeah.
Okay, so
The objection was warm-ups. The patient said, "I've done these warm-ups for a month, and I'm not going to do these last two anymore."
wow.
That's probably what they would say too. So David would reply, "Yeah, you have done these warm-ups forever, and doing the same thing can be boring. Is that why you don't want to do it anymore?" The patient says, "It's boring, but it's also difficult." So David would reply with, "Well, whenever you're bored, sometimes we can progress it or make it more difficult, so you feel like you're moving forward and are less bored. But if it's difficult, it might mean that you need it more, not less, because difficulty is a sign of weakness within your body. Your goal being here is to feel better and eliminate weakness. Can you progress the exercise? Or do you need to tweak your form at your current level?" The patient, "I would like to progress. Can we try?" Me, "I will never deny your progress unless your body denies it first."
Wow. Very good. So, hi Kaylee. She's on this. Hi Kaylee Hart. Kaylee, aren't you supposed to be working right now? Okay. So, David, based on everything you've heard with us going through everyone else's, what would you say to critique your own right now?
Just too big of steps, like less time in between each question for them.
It's all good stuff you said.
Take them through it.
But it's kind of like saying a piece, ask them a question, saying a piece, ask a question, like checking in more, right?
Yeah.
Right. But essentially, to summarize what David said, when a patient says, "I don't want to do my warm-ups," she said, "I thought I'd join in on this, quote, staff training," smiley face. Okay. Well, thanks for joining us, Kaylee. So as far as with David, in his sequence of a patient says they don't want to do the warm-ups, it's understanding why they don't do warm-ups, saying, "Well, I'm assuming you're saying that because it gets a little boring, gets a little redundant. Is that why?" And they say, "Yeah, I don't want." Are people saying that? People saying they don't want to do warm-ups?
Yeah, I mean, very rarely, but it happens.
Yeah. So, I mean, like something too, you could be like, especially if they're athletic, you can say, "Do you just go out and start swinging a baseball bat without warming up?" No. And you're like, "Yeah, it's not the most fun thing to warm up, but do you think it's necessary? Like, why do you think we have you do the warm-ups?" Like you can start asking them that and get them to say what they think the purpose is. Because essentially the spine warm-up is before they get into traction, sometimes before they get adjusted, right? And then especially if they're saying it's hard, you're saying, "Oh, it's hard." So it's hard meaning that it's still a challenge for your body. How often do you do these warm-ups outside the clinic? How's your home care going? And I'd start going into that, because if they did it every day, it's not gonna be hard anymore. And then if you say, "How about we do this? How about we set up a little mini challenge for you over the next 7 days? Will you commit to doing this daily at home? You'll do it daily on the visits you come into, and then it's 7 days, and I'll mark it right now on your travel card. We'll revisit this, and we'll figure out a custom progression for you once you show that you understand this, and we'll keep it exciting, keep it new and fresh." How's that sound? Good. Maybe something like that. Good job, David. Next.
All right.
Next, pregnant Brandy.
Because everyone's are so different.
I have to say that for everyone who hasn't seen Brandy in a while, because they're looking, and I just have to tell the Facebook world, Brandy is pregnant. Okay. All right.
Oh, yeah. Not what it
Right.
Say it's not a whole bunch of cheeseburgers.
Right. Everyone's like, "Wow, Brandy really let herself go." I haven't seen her in a couple months. No, she's pregnant.
All right. So this is one of Bailey's. These are real-time objections that she had.
Okay.
So it's good.
Cool.
Understanding how she answered. So somebody called on the phone asking about the new patient paperwork. So she said, hi, I have a question about the new patient paperwork. I see that it says here I'm going to be signing a consent to be seen with other patients in the same room. And
I'm just getting closer so we can hear you.
so Bailey said, every adjustment by the doctor is private and in a one-on-one setting with the doctor and his scribed nurse. We have changing rooms provided for you. The patient's interactions are usually in our exercise and traction area. These areas are used for your exercise therapy treatments. Depending on your care plan, Dr. Todd will discuss these areas with you in more detail at your appointment, and I can show you those areas once you get here later today. And then the patient just said, okay, thank you, and then just follow up with her in the clinic when she gets here. So.
Okay, so has someone actually said that?
Yeah, happened yesterday.
Okay, and so again, someone said, hey, I saw in the paperwork it says that.
I think she was just concerned about, she wasn't aware of the exercise and the traction units. She was just concerned about being around other patients and like her personal space. So I just kind of briefly like explained to her that, no, actually when you get adjusted, it's just one-on-one with the doctor.
Got it.
Scribe, and then once you get here, I can kind of show you the other areas of our clinic where you'll be with other patients.
Well, was that our new patient from last night? Gotcha.
Yeah, she didn't speak.
Gotcha. Okay. Remember, I was live, so no names. Okay, good. Not saying you were going to say a name, just beating you to the punch. Okay, so all right, and that was handled pretty well, and that diffused it and fine.
Yeah,
so it was
when
just
she got here, she was fine.
cool.
All right, that's it.
One more.
I have one. I had typed it out on here. I just didn't get to print it out.
Cool. Let's hear one from Dirk. And everyone, it's Dirk's last day here in the clinic, and he has a very nicely groomed beard. All right. Gotcha. All right. What we got on Dirk's phone?
Okay.
Man.
Here's a good one. Oh, well, these are both good ones. You have to send this to me, Derek. All right, so time crunch. So the patient comes in and they say, oh, dang it. I only have 30 minutes in here today, so I'd like to do an adjustment. And so Derek says, I can totally understand being on a time crunch. Why don't we at least get you back to do some warm-ups beforehand? Does this time not work as well as you had thought beforehand? Why don't we try to find another time that you will consistently be able to complete your full appointment?
It's perfect.
We just want you to make progress on your pain as quickly as possible.
Wait, progress on your what?
Pain. Or
Yeah. Good. It's just I wouldn't focus on the pain.
functions.
Yeah, or get you healthy as quickly as possible. And that's something to just throw that out there real quick, is that people come in pain, and the idea is you're trying to take them from pain and convert their mindset over into this is not just about pain, because if it's all about pain, what happens when their pain goes away? They go away, right? Because they go, oh, problem's fixed, no pain. So most subluxations don't cause any pain at all. By the time you're in pain, the nerve's inflamed, your body's in a crisis. There you go. Thank you, Dr. Fred DiDomenico, for that one. That's grooved into my brain forever. So that was very good. Dirk, what he did is he took the patient who came in, who didn't have time, said they didn't have time, tried to accommodate, get them doing as much as they could that day, but then saying, do we need to look at your future scheduled appointments, find a different time for you, because it sounds like this might not be a good time that works for you. And we obviously want to keep you on track with care so you get the best results possible, right? That's what you want to? Great. Let's look at the schedule. No, it's just a freak thing, just today. Bummer. Hey, just so you know, we actually reserved this time for you, so we have 90 minutes reserved for your appointment today. And I'm not saying this to make you feel bad, but I just want you to understand how it works. We literally have other patients that we can't get into this time because we booked this time out for you. So today, if you ultimately cannot do all the services that we had mapped out for you, we'll accommodate the best that we can, but we just want to emphasize the importance of finding a time that you are very confident that this is not going to happen again. Okay, sound good? And the patient's like, oh, right? Versus they say, I don't have time. Okay, cool. You know, like that's obviously what we don't do, because then the person's like, oh, it doesn't matter what I do. Cool. All right. Dr. Eileen, how's it going? All right, everyone. This was a staff training. This was a great idea that Brandy had, I believe. Was that your idea, Brandy, to do this?
It was a combined.
Okay, I'll give everyone credit, but we'll give Brandy some credit too. So,
Maybe between you and I.
okay, I'll give.
Don't give me all the credit.
Cool. I'll give Brandy most of the credit, and then the rest of the team the rest of the credit. I'll take no credit. That's okay. So here's what we did. We went through objections, and then all the team wrote out. They wrote out objections, and they literally wrote out the conversation of how it would go, which is a great way to get people thinking on what are things you hear often, what do patients say, and then how do you navigate through that conversation. And so we went through a few of them, a bunch of them before we started the Facebook Live. Unfortunately, they were all really good. Great work, everyone. Very proud of you all. I think we should put these all into like a booklet.
Yeah, I'm gonna make a copy.
That'd be great. So we should take everyone's stuff that you wrote up, we should put it into a central location, and because it's really good stuff. Cool. All right. Hopefully it helped everyone here. See ya.